Doctors and nurses have struggled to get the personal protective equipment, PPE, they need.
Good morning and welcome everyone.
In Seattle, that's been the top issue for Dr. Amy Compton-Phillips, the chief clinical officer of the Providence Hospital Network.
Last year, across all of Providence, we used 250,000 masks. In the first 3 months of this at Everett, they've used 250,000 masks. We cannot have our own caregivers going down from COVID while they're trying to take care of the community, because the supply chain is just not keeping up with our needs.
Amy, I have to say, if I can't assure them that they're safe, then I don't think the rest of this is worth anything.
Inside Providence's emergency department, tensions around PPE have been high. Dr. Ryan Kay is the department's medical director.
It's exhausting to constantly think about the sequence that you put things on and take things off and where you're sanitizing during that sequence. Every nurse, every tech, every physician I've talked to has said, I've been working for years and I've never been so exhausted. And it leaves people just on edge all the time.
We have enough N95 masks that people should not have to bring in their own masks at this point in time.
Okay. Is the recommendation still one N95 for 5 patients, or are we using these all shift now?
We're using them with a face shield for as long as you need to use them. You just store them in a paper bag until they become moist or soiled.
Okay, so forever.
Well, not forever.
Reusing masks and storing them in paper bags wasn't the only DIY workaround I saw. I caught up with Dr. Compton-Phillips at the otherwise vacant Providence headquarters. Inside a large meeting room, she and a handful of her team were spread out a safe distance, cranking out face shields.
Our caregivers would normally have protective goggles on and a surgical mask underneath this, and then this goes in front and basically protects against droplets.
They had raided a half dozen craft stores to scrounge up supplies.
We're at 288 now. We're going to get to 1,000 by tomorrow.
We're retooling our resources going into war against COVID. I feel like Rosie the Riveter.
$4.99, $500.
On the one hand, this is really, it's kind of heartwarming, but it's also really sad.
Desperation?
Yeah, I can't decide which way to go in this. What are your thoughts?
I would rather offer our caregivers something than nothing. And at the moment, if the choice is not having PPE or having homemade PPE, we're going to offer them homemade PPE.
Right.
So.
That's what motivated Jeff Kaz. His small family business builds and sews furniture for aviation and retail customers. He decided to pitch in and start making masks.
There's not a shortage of the raw materials, at least. That would be, not yet.
There will be. Yeah, there will be, yeah. So I think we have enough to make 2 million masks.
But how long will that take you to do?
Well, it depends on how fast we want to go.
How fast do you want to go?
We want to solve the problem. My assumption is that we'll be ramping up for several weeks and then drop off a cliff. Nobody will need me in the healthcare business anymore, and then survival becomes a question for my company. So that's probably the next scary thing, which is less scary than what our healthcare friends are going through right now. That's the bigger issue for me.
We knew in January what we would need. We knew we would need gloves and masks and respirators and ventilators. 2.5 months later, we're dependent on sewing circles to supply our frontline heroes with what they need. It may be a nice American story. I find it pathetic.
Washington state officials, like others in the country, say this was an avoidable crisis.
Because we've lacked the federal leadership we needed, it's been mayor versus mayor, city versus city, state versus state, trying to get access to the limited resources to protect our communities, whether it's ventilators or masks for our healthcare workers. All of that has become this Hunger Games process where everyone's trying to figure out a way to outbid each other. Washington State had a line on masks that were coming into the country and at the port in California. Suddenly, multiple states were bidding on them. That shouldn't be the way that it happens.
Searching the world for every potential warehouse that have any of this personal protective equipment, That has been a constant struggle, and we are bidding against each other, and I'm sure that the suppliers are having a field day bidding the price up while states are bidding against one another. It would be much more efficient, economically and otherwise, if the federal government was playing a more vigorous role in that regard.